anecdotal experiences with clients, as well as research has shown that the women who typically have these issues are the good girl or type A. They are very structured, very organized. Again, this is a generalized statement, but this is what I've seen as the most common. These women have been straight A students or worked really hard in school, really like to do things right and go above and beyond. They've also, like I said, liked control and structure. There's, and when you're looking at the clients that you have in your office, the list that's here is, if you see them, if you start to notice it with clients, if they don't come to you presenting with anorgasmia or dyspareunia or vaginismus, then, and they're coming to you for other reasons, if you see any of these, it might be a little flag to check into what they might be going on, what might be going on with them sexually. So if they have a physical intimacy, if they're avoidant of physical intimacy, that means even like holding hands or cuddling or just any sort of touching with their partners, that might be a sign. A lot of women use pets, children, and work to kind of put that in between physical intimacy or relationship concerns, and it's a defense. It helps support them and keep them safe, but it will more than likely become a problem or an obstacle for them to get over. There's usually a difference in arousal and desire in partners, and then there's, similar to the avoidance of the physical intimacy, not just sex, there tends to be an avoidance of sexual intimacy, and then conflict in the relationship. And you'll also want to make sure that you do, in addition to any sort of medical conditions, medications that they're taking, substance use, exercise, those are all assessment points that we make sure to hit on when we first see a client. You'll also want to talk about sexuality and sex and how they're feeling about it. And that we sometimes forget to do that in a general assessment with a client who doesn't present with a sexual issue, but it's really important to make sure to get that sexual piece in as well. And then if a client comes to you with a sex therapy issue, you'll want to know what all of these things are and how they're presenting in their life, because it could be, like I said, something as simple as you need to hydrate more, or you need to exercise and stretch your body more. So there's a lot of pieces in our everyday life that come together to create certain issues, and knowing about the full spectrum of what your client is going through will be really helpful. When doing a sexual assessment, this is a general, these are some general points that I think will be really helpful in helping you understand what sex has meant and what sexuality and their body has meant to the women that come to see you. You'll want to know everything, that even negative things as well as positive things, especially first, any first time of masturbation, first time of a sexual experience, if there were any emotions around that, so if there was shame or guilt, and then of course the positive experiences and how those were different, what made something positive and what made something feel negative to them. You'll want to see the temperature and the attitude that women have around sex and sexuality as a child, a teenager, and an adult, and what might have changed for them, what they imagine might have been something that changed in their eyes from a child to a teen and a teen to an adult, and what sort of things influence them. And then again, you'll see this point come up a lot throughout this, because I think that the way that our society and culture views women and sexuality is going to play a really big part on what feels okay for women to be able to embody. And they have really profound impact on these women in regards to how they're able to feel comfortable expressing themselves and their sexuality. Identifying how they feel about their bodies, and especially around anatomy, odors, and fluids. A lot of women don't realize that, for instance, like the vaginal smell can be different from time to time depending on what point they're at with their cycle, for instance. And women aren't taught this necessarily, and so they feel really reserved, they feel really bad about this. But simply letting them know that it could change and that they might not like the smell, but it might be appealing to their partner, might be enough information or permission given from you to them that could be really helpful and open up their ideas and their mind about what is okay, and getting them really comfortable with their body and their odors and fluids. And even lack of fluids too. A lot of women get concerned that they don't have enough lubrication and that they feel abnormal for those reasons. And so being able to talk about the differences with women about that. And then, like I said, talking about the positive experiences, because you really want, for the most part, I want to assume that they have been given some negative views on sex and sexuality in their bodies, and so I want to be able to try to provide a positive space for talking about the good things, the things that they enjoyed, and that will be really helpful down the line as you start to help them increase their idea of fantasy in order to increase their arousal and their desire. All right. When it comes to sexual pain and vaginismus and orgasmia, you'll want to get a sense of the exact and specifics around this so that you know what you're sort of dealing with. I'm going to take sort of a narrative postmodern approach to this and sort of externalize the pain or the sensation. And so imagine that this client is coming to you with an object and is saying, here's an object that you've never seen before. Like, help me make it awesome. And you'll want to know everything about that object through the client's eyes. So what does it look like? What color is it? What's the temperature? You would want to know everything about this object if you've never seen it before and it's really important to this person. So asking them, what's the depth of the pain? Is it more on the opening? Is it deeper inside? Does it feel like it's at the 12 o'clock position of the opening? So if you teach a client about if this is the vaginal opening, legs are up here straddled, and this is where the clitoris is and this is where the anus is, you'll want to know, is it at the 12 o'clock position or is it at the 6 o'clock position? And help them guide that way so that you can have a sense of what it is. And then also, when you're talking with the medical professionals, you'll be able to have that lingo, because that's often how they talk as well. They refer to the anatomy in that way. And then you'll want to know the quality of the pain. Is it a sharp, searing knife, or is it a deep, dull ache? Is it like cramps? Is it like a stick? And just kind of get their descriptions of it. It'll help you understand it better. And then the same thing with attempting to reach orgasm. Some women feel no increase in excitement, and they don't feel a plateau. If you're thinking about it in the sexual response cycle, as Masters and Johnson refer to it, sometimes they don't even feel that increase. Sometimes they don't feel that plateau, or sometimes they have it to the plateau, for instance, but they never reach orgasm, or they never reach climax. And some women experience a deep burning sensation, and so then they can't continue on with the orgasm because they're afraid that it's not right, or they might feel like they have to pee. So any of these sorts of things are helpful for you to know so that you know how to move forward. And for each client, it'll be pretty different. And then you'll want to, once you get a better sense of these two, you'll want to know what the feelings are around each part of it. What happens before you start to experience or attempt to experience an orgasm, or what happens before the pain? What are your feelings around it? What are your thoughts around it?